like you said, it's a black and white rule where a lot of times you're just going to say, uh, I'm sorry, you're denied, even though you may have a really severe mental or physical disability. And a lot of folks, that when they hear that are pretty upset. Like, hey, I'm doing everything I can, you know, to make it to this job. I'm working my tail off, but a lot of judges would be like, we applaud you for doing that, but unfortunately, we still can't give you Social Security disability benefits. Good morning, Mervyn.
Good morning, Mr. Evans.
How are you today?
Good, good. How are you?
I'm great. Um, just by way of quick introduction, I wanted to introduce you to our audience who may not have watched your video, your biography video, which I'll link in the description below. But your name is Mervyn Kurniawan. You're a non-attorney rep for our firm, but you've taken the exam that was given by Social Security to qualify you to represent people in Social Security cases and be directly paid by Social Security for that work. And you've been employed by our firm, I think all in, I'm guessing 3-4 years now. I don't know the exact time frame, but I love to refer to you as my ambassador of hope and encouragement and knowledge. So I'm really grateful to have you as part of our firm and to that you represent those things.
I appreciate that, Peter.
So one of the things that you work on for the firm is not only helping people, understand their case and dealing directly with our clients, but a lot of times we get cases that are kind of more problematic in a sense from a legal standpoint or a factual standpoint. And those cases arise to your plate for your review, so you can chat with the client about how we can proceed forward. And so you and I had a chance to talk, and I think we were trying to come up with a top 9 or top 10 list of things that are kind of the biggest pitfalls and how clients can screw up their case if they're not careful. And so I want to ask you, kind of just as working through that list together today, what are some of the top things that you see clients having missteps in their Social Security cases?
Yeah. A big one, I would say top number one would be lack of medical treatment. Something that we always advise our clients or even our potential clients, the importance of medical treatment, consistent medical treatment, and compliance with medical treatment as well. This is critical to winning a disability case. I think people are also, they've heard that there are doctors at Social Security will have the discretion to have you see at Social Security's expense. These are called consultative examinations. I think some people may be under the impression that the consultative exams, or CE for short, is enough to win a disability case. And in our experience, we would say that not quite. A CE can be consistent with a disability case, but unless you are showing consistent medical treatment and compliance with what your treatment providers are recommending, it's an extremely uphill battle to win your disability case.
What are some examples of non-compliance, or the most popular examples of non-compliance with medical treatment are you seeing in clients' cases that are kind of falling into your plate?
Yeah. I would say a big one is not taking your prescriptions. That can be noted in the medical record and be grounds for a case to be denied if a claimant is not taking their prescriptions as recommended by their doctors. How about for you, Mr. Evans? Anything that you notice big pitfalls with with compliance with medical treatment?
Yeah, I think prescribed medication is probably the number one thing. And then the number two thing is missing your doctor's appointments pretty consistently. You just don't show up. And those missed appointments make it into your record. Like, oh, claimant failed to show up, patient failed to show up. And if you get too many of those, of you're basically not showing up more than you are showing up, then Social Security is going to raise an eyebrow and ask you about it. Like, why do you keep failing to show up?
Yeah.
I think one of the things about prescribed medication that, I hear a lot from clients over the years is that, oh, they don't do anything for me, or the side effects are so horrendous, I'd rather just deal with whatever's going on. And I completely understand that. But you have to get that into your medical file with your doctor saying either these medications don't do anything for me, or can we, the side effects are so horrendous, can we please try something else? What I've told clients over the years is that you really need to show Social Security that you're trying to get better. You're fighting to get better. And maybe it's a switch in a doctor, right? Who's willing to listen or willing to prescribe the correct medication. Now, I know that's easier said than done in our current healthcare system. And I know, with different medical healthcare, health insurance, it can be more challenging too. Especially if you're on a state Medicaid plan, it can be very challenging to just switch doctors on a whim. But at the same time, the duty of proving a Social Security disability case is on the claimant, right? So you have to get those medical records. But yeah, you're absolutely right. The number one thing to ruin a case is just, don't get medical treatment and don't do what your doctor tells you to do. Let me ask you this, and I asked this of Judge Hyatt, as you know, who works for our firm. Is there a magic number in your mind of how often a claimant should go see their doctor?
This may depend on a case-by-case basis, right? For a case that has a mental health component, I like to see as much as possible regular appointments with a therapist that could be once every 1 to 2 weeks. I think would be considered a baseline level of regular appointments with a therapist. For other conditions, that number would be quite high. A weekly or bi-weekly appointment for something more a more chronic physical impairment, that could be once every month, potentially, once every 3 months. Again, it can vary from state to state, depending on how robust the healthcare system there is, especially for folks who are on Medicaid, and their options are kind of constrained by what their state Medicaid program will pay for. And then there are some conditions that perhaps one visit a year is sufficient, because the objective medical evidence from that one visit is so powerful that it alone can win a disability case. I'm thinking of one case in particular. It was a vision-related case, and based on the extensive exam that was done in one visit, it showed that the person's vision had deteriorated to the point where it met a listing in Social Security's Blue Book, and the claimant was approved for their disability benefits. So it can vary, but that would be my answer to that question. What about you? Any magic numbers that you have?
Well done, by the way. Judge Hyatt kind of basically said the same thing. There is no magic number, and it's so dependent on diagnosis and treatment and severity. No, I agree. I mean, if you were to force me to give numbers, right? I think there's kind of a checklist that I could write up on certain diagnoses. So, for example, mental health diagnoses, specifically depression and anxiety, you'd want to see at least one psych eval, that has been more recent in the last maybe 1 to 2, 3 years in that range, and then consistent counseling. And I think once a month would be the baseline, a very baseline, along with taking medications as prescribed. I think when you get into things like, maybe schizophrenia, some other more severe things, you're going to want to see maybe an increased level of counseling. And it's going to depend on how well things are controlled by medication versus a therapist or psychiatrist or psychologist. So that will depend. It gets a little bit tougher in the physical cases, because when we talk about physical, you're talking about everything from, amputees to obesity to, bad backs and neck. There's so much, and then there's a wide range of severity. People who need surgery right away versus people who it's controlled with, the doctors are recommending physical therapy. So I think it's going to come down to what your doctors recommend. As we're not doctors, so if your doctors say, hey, you need to go to physical therapy first before we kind of explore surgery, you should go to physical therapy, and then your physical therapist will say, hey, you need to come back once or twice a week, or once every other week, and just follow that regimen. So you answered it perfectly, in a lot of ways, that it just is, like you said, so dependent on diagnosis, severity. And like you said, if you're blind and there's literally no cure, other than something extreme, like, maybe a cornea transplant. I don't even know if those work, but, and Social Security has rules around that. Like, if there's a treatment that is, and I don't remember the exact wording off the top of my head, but basically, like, it feels extreme to you, and you can justify, like, hey, look, I don't want this neck surgery or back surgery, so I'm not going to follow that because the risks for me are too high. Social Security will accept that.
Yeah.
Right. You're not required to go get it. But if it's something like, hey, did you try physical therapy, at least once or twice to see, and you didn't even try, they may raise an eyebrow at that. So it's a balance. But yeah, I think you answered that question perfectly. What is the number 2 thing you're seeing in ways that clients are, for lack of a better word, screwing up their cases?
Yeah. One that's really important. This is a real hard rule. Is around working. Social Security has this term. As far as I'm aware, this term only exists in Social Security law. Other places related to employment, they don't use this term. But the term is called substantial gainful activity, or SGA for short. It's essentially a limit to how much you can make in gross monthly wages before you are no longer considered disabled based on your earned income. And it's important to say it's earned income, especially for Title II disability insurance cases. You're allowed to have unearned income not count towards this SGA limit and not preclude you from applying for disability. SGA for 2024, the year that we're making this podcast, is $1,550 in gross monthly wages. And by that, we mean before taxes. So as someone who is working and making more than that amount of money will be considered not disabled. And it's when I say a hard rule, it's something that you can make the most impassioned argument to a Social Security judge for why you are medically disabled. But as far as I'm aware, if you're making more than that SGA limit, their hands are essentially tied. Now, there are some exceptions. You can deduct for what they call disability-related work expenses. But in practice, the amount of disability related work expenses that could really chip away at that $1,550 resource limit, or sorry, the earned income limit, is in practice not a huge factor. And especially because something that you pointed out to me before is that judges also look at how close are you to that limit, and they have the right to ask Mr. Claimant or Ms. Claimant, what's preventing you from working 1 or 2 more hours and going above that limit? And I what I tell claimants is you got to be honest, but a good answer relates back to your health. Your Honor, I've tried, and I can't work any more than what I'm doing. A bad answer would be, well, if I worked any more, I would lose my disability case, so I'm not going to. That would not be consistent with disability.
Yeah, no, you're right. And then one thing, there are exceptions. We could talk about, special accommodations and the kind of how do we write that off, kind of the sheltered workshop exceptions. I don't want to deep dive into that too much. There are exceptions, but generally speaking, in practice, if you're out there working for an employer and you're making, or yourself, and you're making more than $1,550 gross income per month, it can really, like you said, it's a black and white rule where a lot of times you're just going to say, I'm sorry, you're denied, even though you may have a really severe mental or physical disability. And a lot of folks, that when they hear that are pretty upset. Like, hey, I'm doing everything I can, to make it to this job. I'm working my tail off. But a lot of judges would be like, we applaud you for doing that, but unfortunately we still can't give you Social Security disability benefits. Will you address the 12-month rule?
Yeah. This comes up a bit because outside of Social Security, there's this term short-term versus long-term disability. So I get asked, how does Social Security consider short-term versus long-term disability? And what I tell folks is that terminology is not used in Social Security law or regulations. Instead, Social Security defines a disability as a severe impairment that has to last at least 12 months or is expected to end in death. So that doesn't necessarily mean that you have to wait 12 months to apply for disability, but the medical records has to show that this is a condition that your doctors believe will be long-term enough to last more than 12 months. And because of how long a disability case often takes, by the time you get your initial determination, 12 months may have in fact passed, and it shows that you've been dealing with this issue for at least a period of 12 months. Something related to this that I saw in my Social Security exam is, suppose you have a condition, one condition that lasted 8 months, but during that 8 months you have another condition that lasts another 8 months. So in total, you have 16 months of severe impairments, but they're based on 2 separate impairments that alone did not last more than 12 months. The question was, is this person eligible for disability benefits? And the correct answer, which I got, is no. Though Social Security will consider the entirety of your health when determining a disability, if there isn't at least one impairment that lasts a full 12 months or more, the person is not eligible for disability benefits.
Right. And I think the reason I wanted you to address that 12-month period is because often what we'll see is people will call us, they're out of work, and maybe they've been out of work for a month, right? And then they apply. And then maybe a few months go by, they get denied, let's call it 7 months. They get denied, we appeal, and then they go back to work. And they may not call us to tell us, or they may just not tell us at all that they went back to work, but they've only been out of work for, let's say, 8 months. And then, 2 years go by and they've worked very successfully for 2 years, maybe not making a ton of money. But then by the time we're there, they've never told us they went back to work because it's not like we know. We don't follow people around or have access just instantly to their W-2s or tax returns. Then all of a sudden, we're at a hearing and we're like, hey, look, you've only been out of work. What? You've only been out of work for 8 months. So now, in essence, their case is done because there is a thing called closed period, but that means your case, you have to have been out of work for 12 months, an exact full year or more, 12 months or more. And if it's anything under that, you're not eligible for even a closed period. So we see that as a big way that folks kind of can, and I want this to be said and known about me, and you know this very well, and I've said this many, many times. We're not in the business of, creating disabled people, right? Like, my goal is not to tell people, don't work, even though you think you can. But what I do want to do is kind of let people know, like, hey, if you do go back to work and you've only been out of work for, let's say, 5, 6, 7 months or less than 12, and all of a sudden you're expecting to get Social Security disability for that time frame, if you're over that SGA mark, you're not going to be eligible. So it's kind of creating that expectation for folks who go back to work. Now, there are exceptions like the unsuccessful work attempt, which we could do a whole podcast on, and I don't want to deep dive into it. But generally speaking, you need to be out of work for 12 months or more, or expect to be out of work for 12 months or more. And so, like you said, you don't actually have to be out of work for 12 months before you apply, but in your head, you expect to be out of work for 12 months or more. What is the number 3 thing that you see as ways that kind of people or clients kind of screw up their case?